Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minger, and I'm so glad you are listening today. Today, I'm going to be talking about the concept of estrogen dominance. Now, this term has gained a lot of popularity on social media and blogs, as many women can identify with some of the symptoms that may be seen with estrogen dominance. We're going to talk more about ways to determine if this is actually what you have going on, as well as ways to manage your symptoms appropriately if needed. So let's get started with a story about a past client of mine who we'll call Brooke. Now, Brooke had taken an online quiz because she was having some symptoms, and that quiz told her that she had estrogen dominance. Now, she started taking some over-the-counter supplements to help block excess estrogen because that's what the quiz had told her to do. She went on to continue to take the supplement, and she started to notice some significant worsening of fatigue, decreased libido, and eventually her periods stopped altogether. Now, Brooke went to see her family doctor, who then checked some basic labs, which were all normal. She was told that she was likely going through early menopause. However, Brooke had a friend who referred her on to our office for further evaluation. The first thing that we did was to evaluate all the supplements she had been taking and found this supplement that would be blocking estrogen. And so I had her stop that medication right away. We let her menses return, and she did start having regular cycles again. We let this continue on for the next couple of months, and she was back to her baseline. At that point in time, I rechecked her labs, which actually did not show signs of excess amounts of estrogen. Instead, we treated appropriately her underlying lab abnormalities and focused on improving her symptoms, which helped improve her quality of life. Interestingly enough, we confirmed that Brooke was not actually in menopause, and this would have been an improper diagnosis had she continued on this path of treating herself based on that online quiz and what she read about on social media. So let's talk about what estrogen dominance is, because it is a real thing and some women do have it. And I'm not saying that, we shouldn't be mindful of this, but it's really important to know that estrogen dominance should be diagnosed through symptom evaluation with a healthcare professional, as well as lab work. Now, as we've mentioned so many times on this show, it's important to time your lab work if you're still having your menstrual cycles, as estrogen levels do naturally fluctuate throughout your cycle. Now, there are times when your estrogen should be higher, there are times when it should be lower, but we do see this natural progression over time that as you approach a perimenopause transition, as you have more birthdays, you get more towards that menopause time, your estrogen can begin to fluctuate a little bit more. So let's talk a little bit more about this concept of estrogen dominance, and there's kind of two different ways I want you to think about it. So for the purposes of this illustration, these are imaginary numbers. They're not actual lab values, but just so that you can visualize this. Let's say we have a well-balanced estrogen and progesterone levels, and these are the two hormones primarily that in women who are having menstrual cycles work hand in hand to keep things on track. So let's say I check your levels, you are completely normal, your estrogen and your progesterone are both at a level 10. Now, there are two different ways that you can have a diagnosis of estrogen dominance. One way is to have a true estrogen excess. So I check your progesterone level, it's at 10. That's normal. But I check your estrogen level and it's at 15. That does show an estrogen excess, so you're going to have estrogen dominance. The other way that's much more common that I see in my practice is that you have what we call a relative estrogen dominance. So if I check your estrogen level, it's at 10, which is normal, but your progesterone level is 5. So in this case, the estrogen is totally normal, but the progesterone is low, and you still have estrogen dominance. So there's two different ways that we can see this estrogen dominance playing a role, but it's really important to know that if you do have estrogen dominance, which type do you have? Because treatment is going to be entirely different. In the second example, where your estrogen levels were normal, but your progesterone was low, if we give you a medication or a supplement to block your estrogen, now you're dealing with a low estrogen and progesterone. And this was what we found was the case in Brooke's situation, is that her estrogen was actually normal. She just had a progesterone deficiency. And so obviously the treatment is very different than just blocking the estrogen. So how do I know if I have estrogen dominance? What symptoms might I notice? So most of these symptoms, we're going to think of having that either true estrogen where it's higher than your progesterone levels, or perhaps that relative estrogen dominance where the estrogen is actually normal and the progesterone levels are low. So when we think about progesterone to start off with, we're going to think about calming effects, right? So calming effects of progesterone help us to sleep better. They reduce your anxiety levels. They reduce irritability. And so when we see the opposite of those things, it leads us to believe that perhaps you have a decrease in progesterone or perhaps an estrogen excess. And so oftentimes the mood changes we notice are going to be more mood swings, more irritability. Very commonly with estrogen dominance, we'll notice some menstrual cycle changes. And for many women, this shows up as heavier bleeding or excessive bleeding or cramps. Sometimes we'll even notice irregular menstrual cycles altogether. Now, whether that's from the progesterone or the estrogen being off, it still is going to show that same picture. I oftentimes also will pick up estrogen dominance in couples who are working through fertility troubles. If you have too much estrogen but not enough on the progesterone, that can cause some problems with getting pregnant. Other symptoms that you may notice that aren't necessarily related to your menstrual cycle can include changes in your libido, sleep difficulties, troubles concentrating, mood swings, hot flashes, bloating, tenderness in your breasts or swelling, and weight gain. What we know is that estrogen is stored in your fat cells, and so you don't get more fat cells over time. They typically will just grow in size. And so if we have more estrogen that's trying to be stored, your fat cells will increase in order to accommodate that excess estradiol. And so we do oftentimes see increased weight gain with estrogen dominance. So when does this typically become problematic? We oftentimes will see, as was the case of Brooke, that it can happen after age 35, oftentimes during this perimenopause timeframe. And again, from some of our past episodes, you'll know perimenopause can begin as much as 10 years prior to the onset of menopause or when you stop having your cycles altogether. Now, other than just having more birthdays and aging, there are other factors that influence your likelihood to develop estrogen dominance. And one of the things we see can be nutritional deficiencies, especially being low in B vitamins and iron. We also can see an increased risk of estrogen dominance in people who deal with insulin resistance or glucose intolerance, in those who have chronic stress or problems with their cortisol, whether that's emotional stress, physiologic stress, physical stress, medical problems. All of those things can increase cortisol and have increased problems with estrogen dominance. The other big areas that I oftentimes will see estrogen dominance is in women who are taking oral contraceptives. Most of the oral contraceptive pills do have some version of estrogen in them. And so by increasing your levels artificially, we can see some estrogen dominance. We also see that oral contraceptives can block progesterone, so that can still lead to estrogen dominance, just the mechanism of action is different. And then one of the other big areas that we're finding has a bigger link to estrogen dominance than we previously knew is exposure to toxins or environmental chemicals. So there's so much that we don't know when it comes to those different things that we're being exposed to on a daily basis, but we do know that it's playing a role when it comes to estrogen dominance in women. So how can I prevent estrogen dominance, or what can I do to treat it if I find that I do have it? Now, again, it's really important to be working with a healthcare professional to determine which type of estrogen dominance do you have. If you truly have an excess amount of estrogen in your system, then there are some supplements that we recommend that you can help in order to decrease that estrogen level. One of those is called DIM, and the full name of that is diindolyl methane. Now, you can get DIM naturally through cruciferous vegetables like broccoli and cauliflower. But most often when we identify an actual estrogen excess based on lab evaluation, we recommend taking an actual supplement to help bring those levels down more quickly. Now, it's really important to remember that if your estrogen levels are normal but your progesterone is low, if you take DIM, you're going to be doing yourself a great disservice. So please do not just start taking this medication without having the recommendation of a healthcare professional who has looked at and evaluated your lab levels. Other big ways that we know that you can get rid of excess estrogen and help balance your hormones include diets that are high in protein, healthy fats, vegetables and fruits, and really focusing on getting enough fiber content. The recommendation for most women who are still having menstrual cycles is to get approximately 25 grams of fiber in per day. What this does is allow your body to bind those excess hormones, excrete them naturally through your liver, and get them out of your system so that you are eliminating those excess hormones naturally. Because of this, we also want to make sure that you are limiting your alcohol usage. And for women, the recommendation is no more than 1 to 2 alcoholic beverages per day. Now, this does not mean you can save up and have them all on the weekend. That is not great for your liver. We also want to avoid any processed foods wherever possible. Again, trying to limit our exposure to those unnecessary toxins or chemicals, but also helping your body to process those hormones naturally. Other ways in order to help reduce estrogen dominance are going to go back to reducing your stress levels. As I mentioned earlier, when we're trying to regulate cortisol, we want to focus on anything we can do to eliminate stress or reduce the impacts it has on our body. So whether that's mindfulness, prayer, yoga, meditation, engaging in hobbies that you enjoy, or connecting with friends or family members, all of those can be great ways to help reduce your stress levels. Again, exercising, we're going to want to focus on that walking at least 30 minutes daily. And all of these can help to just balance out your hormones in a general nature. Now, what if I do nothing? What if I don't want to do all that lifestyle stuff? What if I don't even know that my estrogen levels are dominant compared to anything else? What if I choose just deal with the symptoms of the weight gain and feeling yucky, and I realize this is just my lot in life? So the good news is that for some women, maybe nothing happens. Estrogen dominance is not necessarily one of those things that is life-threatening. Some women have normal menstrual cycles, and some women are able to conceive naturally if they have estrogen dominance. So perhaps nothing needs to happen if you have estrogen dominance. However, for many women, they end up noticing over time that they are noticing increased problems with their menstrual cycles, heavier cycles, and weight gain. And those are the most common things that I see women come to me with when we end up diagnosing estrogen dominance. Over time, if you are somebody that has dealt with this since you were in your early 20s or 30s, we can find that there is an increased risk long-term to develop increased endometriosis symptoms, as well as the development of fibroids, and a possible link to breast and uterine cancer risk, especially in the estrogen-dominant types. So even though those risks are low, they definitely don't happen to everybody. My recommendation is always, if you have symptoms, evaluate it. Work with a healthcare professional to determine if this is what's going on. Can I treat this and be proactive so that I'm not having these troubles lasting well into the rest of my life and impacting my quality of life down the road? Imagine if you could determine if your symptoms were truly related to estrogen dominance or if there was something else going on. This would allow you to understand if you did have estrogen dominance, if your problem was actually too much estrogen, or if you had a deficiency in progesterone. Since the treatment courses are completely different, understanding your true issue will help long-term to improve your health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.